You're watching and listening to the Electronic Intifada live stream. I'm Nora Barrows-Friedman with Ali Abunimah. We're now joined by Dr. Yipeng Ge, a physician based in Ottawa, formerly a resident physician at the University of Ottawa's Faculty of Medicine. In November, Dr. Ge was suspended by the university over social media posts supportive of Palestinian rights. He was reinstated in January but has not returned. In December, he resigned from the board of the Canadian Medical Association, citing the group's refusal to take a stance in the face of the ongoing Israeli apartheid and genocide. And in February, Dr. Ge spent a week in Gaza's southern city of Rafah. Dr. Yipeng Ge, thank you so much for being with us today on the Electronic Intifada live stream.
Thank you so much for having me.
First off, your thoughts on, what Abu Bakr was talking about in terms of, he's someone with already a chronic illness. He, like so many others, are having to choose between starving or eating bad quality food. He's talking about hepatitis. He's talking about all the effects of not having, of Israel engineering the starvation and forcing people to make these just impossible choices. What are your thoughts on hearing him and knowing what you know about chronic illness and starvation in Gaza?
I mean, it's an honor to first of all be here and to listen to Abu Bakr share his story and also his hope of what gives him hope, and I think being in community and being here. So thank you for having me first and foremost, and this is healing for me to be in this space. I think so. I'm a primary care doctor. That's what I have been trained in. I've been trained in emergency rooms across the country in Canada, as well as in under-resourced places like Nunavut in Canada's north. And I thought that was under-resourced until, certainly working in Rafah and bearing witness to what's happening at the European Gaza Hospital in Khan Yunis as well, is a whole different scenario, right? And when I think about chronic disease as a primary care doctor, I'm actually seeing patients this morning and this afternoon after this, is the necessary preconditions to be able to manage a chronic disease is all of the important social determinants of health, of having a roof over your head, having like nutritious food, having clean water, having the ability to have money and education so that you can manage all these other things to have a long, fulfilling, healthy life. And to manage a chronic disease, specifically, certain ones like heart disease or high blood pressure or diabetes, or any of the other kinds of chronic diseases that one can encounter, it becomes impossible to manage when you don't have those necessary preconditions for life, for a decent life. Basic human rights, we're talking clean water, we're talking nutritious food, we're talking shelter. And these are things that have been completely systematically withheld or destroyed by Israel in the Gaza Strip. And we know that these things were actually withheld even before October 7th. There's this like Gaza diet that we talk about colloquially, where the number of the number of calories or the caloric intake of people were calculated so as to not kill people, but to limit and stunt their growth. And I remember meeting children around the clinic that followed me around with their smiles and their greetings. And I thought they were, 4, 5, 6 years old by their height. And I talked to other staff members, people that knew these children at the clinic, and they were like, no, you got it wrong. They're like 10, 11, 12 years old. And so the consequences of this over 17-year blockade on the Gaza Strip, including that of humanitarian aid, is just so severe. And now we're seeing trucks enter at a fraction, a third of what was entering even before, when we knew that those caloric intake was being restricted. And so the ways in which anyone can manage chronic disease is almost impossible. When I think about trying to manage high blood pressure or diabetes, I was really not sure what we were doing in these clinics, because what people needed was food, what people needed was water, and also to manage certain conditions, you do need blood work to kind of ensure that a patient is on a medication safely. There are medications that we actually recommend to not take if you're not feeling well, or if you're having a gastrointestinal infection or respiratory infection, or if you're not eating and drinking properly. But how can we counsel someone in this situation that maybe don't take your high blood pressure medications or diabetes medications because you're not eating and drinking? You're not eating and drinking because Israel is withholding these things systematically. And so the medicine that we're trying to do in primary care in Rafah and Khan Yunis is impossible.
And Dr. Ge, thank you again. Thank you so much for joining us. And I mean, and when you talk about chronic illnesses, things that in, say, Canada or the United States or in Jordan or in many countries are completely manageable, whether it's high blood pressure or diabetes, these can be very, not to say they're not serious, but they're manageable with diet, with medication. What happens for people when they run out of their diabetes medication or their high blood pressure medication? Or, I mean, we're not talking now about acute illnesses, people, the thousands of people living with cancer in Gaza who are not, who don't have access to care, but we're talking about potentially hundreds of thousands of millions of people who have chronic conditions, and this is not as, we all see on our social media the utter horrors that are happening in Gaza, the shredded bodies, the bombing, the people being rescued from under the rubble. But it's hard to show a picture of what happens to an elderly person who can't control their diabetes, or who can't get enough nutrition, or can't control their hypertension, or whatever it may be. What are we not seeing is what I want to ask you. What did you see that we here are not seeing?
There's so much, right? There's so many stories that are left being untold, because I think there's a degree of desperation to humanize Palestinians and what they're going through. And I think a lot of the attention is being paid to women and children, for example, when we know that Palestinian men are being slaughtered in Al-Shifa hospital, for example, like all of them. And doctors are being slaughtered. And I think the ways in which I think about the healthcare impacts of what we saw, not only is it the overlapping crises of food, water, and shelter insecurity that has completely decimated everyone, has affected everyone, but when we think about who is most vulnerable, we do think about children, we think about infants, but there's also older adults, people with chronic diseases, people with disabilities, visible disabilities, also more hidden disabilities. I spoke to a psychiatrist and a pharmacist at one of the primary care clinics, where mental health medications, like antipsychotic medications for people with schizophrenia, has just been completely forgotten about. And so there are people that I don't even know where they are, because as a doctor, when you're there as a foreign doctor, you're not allowed to leave the medical compound. There's this thing called deconfliction, where if you're in a deconflicted zone, then you're not supposed to leave unless if you tell the UN and whatever. And so there are patients in like active psychosis that haven't received their antipsychotic medications for months, probably 6 months now, that are just suffering, and their family members, I'm sure, are trying to manage and cope. And so when we think about who is most vulnerable in society, a lot of these humans, right, like adults with chronic diseases like cancer, like all these other chronic diseases that we've already mentioned, are being completely forgotten. There's a challenge, and I remember Dr. Ben Thompson's interview with both of you here. The challenge of diagnosing cancer now with there's no CT scanners really, and there's no imaging capability, really limited blood work capability. The main laboratory was in Al Shifa Hospital, which is completely destroyed now. Everything has been destroyed at Al Shifa Hospital, to the point where there's no pathologist to make a tissue diagnosis for cancer. So you can't diagnose cancer now in any kind of like sort of the word in a way that is standard care, quality standard care. And there's also no way to treat cancer. And so all of these chronic diseases are really very much in the shadows with respect to what's happening. And when we talk about the number of deaths, it's such a gross underestimate. The numbers I think about of the children dying of starvation, for example, those numbers came from the north, and they came when I left Rafah. And I treated patients that had such severe malnutrition that I was worried that they were going to die the next day, if not the next week. And the patients that started to be counted in the north, they had the privilege of dying in front of a nurse or a doctor to be counted. And so I think about all of those untold stories of the children, older adults, people with chronic diseases, people with disabilities that are dying of starvation or dehydration or any other chronic disease and are not being counted because they can't get to a clinic or a hospital because healthcare has been systematically attacked and destroyed in the entire Gaza Strip.
Yeah.
So there's just so many stories left untold. When there is a ceasefire, and I know there will be one, and when humanitarian aid can enter unrestricted, that is when the horrors actually come. I think about how when I was there in Rafah, I was speaking to the colleagues that I went with and the other doctors. I could not comprehend the suffering that was happening. It was incomprehensible. And to know that it's actually getting worse each day, each passing week, is still unimaginable, because I think so many of us still hold on to our humanity. We still recognize and see the humanity in others.
Dr. Ge, during this latest siege of Al Shifa and the horrors that were revealed in the last few days after the Israeli forces withdrew, one of the facts that came out is that the Israeli forces essentially executed Dr. Ahmed 𝐓𝐡𝐞 Tamara, I don't know if you can see in the chat, I dropped a tweet from Dr. Ghassan Abu Sitta, the British Palestinian surgeon who was in Gaza for so long at the beginning of this genocide, and he paid tribute to Dr. Ahmed 𝐓𝐡𝐞, who was executed, according to the reports that came out, along with his mother at Al Shifa Hospital, and many tributes to him, paying tribute to the fact that he never left the side of his patients, that he continued to try to care for them until his last moment. And I'd just like to ask you, Dr. Ge, just tell us about some of, and of course, Dr. Ahmed is among so many medical workers and doctors who have been targeted and murdered, first responders, rescue workers who have been targeted and murdered by Israel. But I just want to ask you to talk about some of your colleagues in Gaza who you met and what you can tell us about them.
The doctors and the nurses, the medical volunteers that I met while in Gaza, I think uphold the highest levels of medical professionalism and ethics and morals that we enter this profession with, to help our patients and communities, no matter who they are. And also this deep commitment and moral clarity as to, in the face of bombs dropping around you, you don't abandon your patients. You look after your patients and you care for them because you have the skills and expertise to help, and you do what you can. Um, unfortunately, to the last moment for some of these doctors. I have the deepest respect for these doctors. Like they, and and I only wish I knew them for longer, or some of them I wish I got the chance to meet them. I think about my colleagues in Canada, like Dr. Tarek Loubani or Dr. Ben Thompson, who have not only been bearing witness to what's happening, and Ben Thompson coming back from Gaza recently as well himself, but to have lost close friends, to have lost doctors that they've trained with and trained themselves, because they knew about the importance of building capacity in Gaza, and giving people who are Palestinian in Gaza the tools and the skills and expertise to look after their own community and their own peoples. And what we're seeing right now is a systematic destruction of that, to destroy the hospitals, to destroy like the people that are in these hospitals trying to care for their community and population, to the point of not only making the situation and the make life unlivable, but to make it impossible to receive medical care at this point. As I watched the 8 or so minute press conference by the head doctor, surgeon at the Al Shifa hospital last night, and it's just been completely decimated, and yet they continue to try to care for their patients. Like one of the doctors that I met at the primary care clinic, they themselves are from the north, from Al Shifa area, and have been displaced 4 or 5 times, lost family members, lost their home, and they're living in a tent outside of this primary care clinic, and doing the unimaginable work of trying to do what they can in treating, bacterial pneumonias, bacterial gastroenteritis, so much hepatitis A, wound infections. But when patients need food and water, and there is none, and to see dehydrated children and malnourished children, and to only give them IV fluid, which introduces another source of possible infection, introduces makes the child like cry, and it's irritating, and it causes trauma, and the parent or the guardian or the adult, or sometimes it's just like another sibling that's with them because they've lost so many family members. It's distressing for them as well. And yet, despite all this, they continue and persist and find ways to care for their patients. If anything, it's to see and to hear someone deeply. And that is a lot of what I do in primary care here in Canada, is to recognize someone suffering. And sometimes you don't have the material conditions in which someone needs to heal, but at least you get this opportunity to like spend time with them and see them as a full complex human, and to share that human experience with someone. But I think even that is being destroyed and impossible to do in Gaza right now, because of how many patients there are, and how stretched the resources are, to the point where in the primary care clinic, I was seeing patients so quickly that it was like 60 to 70 patients in a matter of a half day, so in the matter of a morning. And there's no real way to actually have a meaningful conversation, other than just screening for a couple of symptoms and just, getting them some medication that they might need. The clinics that we went to didn't have antibiotics when we arrived. We brought a supply of antibiotics and started prescribing those. But this is not a solution. There's no humanitarian solution to what's happening. We're seeing systematic attacks on healthcare, on people who heal, as Dr. Tanya Hassan has already put it so clearly, that healthcare workers have a direct target on their back, to the point where they're changing out of their scrubs into civilian clothes because they know that because civilians know too that they're going to be taken by the Israeli forces, detained, tortured, and executed. And it's despite all this, they persist, and I'm so honored to call them my colleagues.
Yeah. We only have a few minutes left, Dr. Ge, but I wanted to ask about the response we've seen like the complete failure of the American Medical Association, for example, here in the States, to express any sort of even just mild condemnation of Israel's decimation of Gaza's healthcare system. And we've seen pretty much the same in Canada, where you work and live. Seems to be absolutely no solidarity at all within the Canadian medical establishment for their colleagues risking their lives to treat patients in Gaza. Can you talk a little bit about that, and what, as you returned from Gaza back to Canada, what the response has been from your colleagues in Ottawa?
The clinics that I work at in Ottawa and in the greater Ottawa region have actually been really supportive. Like, people have reached out to me to say, like, thank you for what you're doing. But I think there's still this blanket atmosphere of silencing, of anti-Palestinian racism, of people with their own internalized anti-Semitism, afraid of being called out as anti-Semitic for any speech related to Palestine. And I think the medical establishment in Canada as a whole, as institutions, continue to be extremely silent. If anything, they're perpetuating anti-Palestinian racism by creating the conditions in which people are afraid to speak up, because they are disciplining doctors, medical students, residents. But I will say, I think the tide is very much turning, where we have coalitions of doctors and other health professionals creating communities of care, of support. I think about Health Workers Alliance for Palestine, based in Canada. We have members across Canada now from many different backgrounds in healthcare, including doctors, nurses, social workers, naturopaths, occupational therapists, dietitians, dentists even. And so the tide is turning in terms of how do we co-create the coalitions that we want to see through the same values and principles that we share. And how do we do this work in healthcare to help liberate Palestine, as in the way that Palestine and Gaza are liberating us from the very clear, blatant abuses of institutional power rooted in anti-Palestinian racism. And we're seeing doctors, I think, over time now, unfortunately, it's taken 6 months, growing a backbone to speak up. We see a group of doctors in Quebec that have written open letter to their college to demand a statement, and their college responded with said statement. We have over 1,000 doctors doing the same for the Canadian Medical Association, but they continue to take the stance of being neutral in the face of structural oppression and ongoing genocide. When, this is an organization that I was on the board of just last year, and knowing what they did for Ukraine, actually, I don't know if everyone is aware of what the Canadian Medical Association did for Ukraine when the Russian Federation escalated and invaded Ukraine, was that they put out multiple statements in support of Ukraine related to healthcare as well. And then they went so far as to divest from the Russian Federation and made a separate post about that, separate statement. And then they worked with other healthcare institutions in Canada, including pediatric healthcare institutions, to fundraise for humanitarian aid. And they put out of pocket for themselves $250,000 for humanitarian aid for Ukraine. And it's been complete radio silence for Palestine and for Gaza. And so the racist double standards could not be any more clear.
And you actually resigned from the Canadian Medical Association board over that, and you wrote a very, eloquent and powerful letter that you actually published. A couple of things. I know that we only have a minute or so, but I just wanted to comment on a couple of things you said. It strikes me, as Nora said in the introduction, that you were suspended in November for things that you said related to Gaza. Dr. Ben Thompson, your colleague who we had on, he was suspended for things he said. You don't need to go into the details of that. But the point is that here are doctors actually being punished for doing the very thing that we're all taught doctors are supposed to do, which is to care first and foremost for human life, to have compassion, the Hippocratic Oath, first do no harm, to heal people. And so it just strikes me that these institutions are actually punishing you for standing by the most marginalized people. So it's very heartening to see, to hear from you about how doctors are now organizing, not just doctors, but people in the medical profession organizing to push back and to speak out. And the other thing I want to say is the importance of the voice of medical workers, because remember this, that Israel deliberately, as a propaganda strategy, pushed so-called first responders. In many cases, they weren't actually first responders. They were Israeli military personnel, or they came from that Jewish extremist group Zaka. But they pushed them into the media, to tell atrocity stories, things that turned out to be complete lies, because they made a calculation and they said it, that, people trust first responders. They trust people who are rescuers or who are in the medical profession. So let's push them out to tell their lies. So Israel actually tried to weaponize the trust and respect that people have for first responders and medical workers in the service of genocide, in the service of propaganda. There were even 100 Israeli doctors who notoriously signed a letter supporting the war and the genocide. So I just wanted to commend you, and on behalf of many of our viewers who are reflecting that, for speaking out, for your insistence on doing so, and to give every encouragement to the medical workers in Canada who are now organizing to do that collectively. It's so vital.
Well, thank you so much for your kind words. I mean, I think about what I signed up for in medicine, but also the framing in which I entered medicine is through the framing of wanting to work on structural oppression and racism and colonialism from a healthcare lens. That's always been my work. My work has been in Indigenous health and anti-racism and decolonizing health and healthcare, including public health, for over 10 years now. And that is the context in which I entered and learned about the issue of Palestine from the framing of settler colonialism as a structural determinant of health. And so what we've also seen through these attacks and reprisals is that they do not stand the test of time. Like the University of Ottawa completely walked back their indefinite suspension on me without any disciplinary action, but did not so much, offer apology or remorse or any reassurance that this wouldn't happen to me or anyone else in the future. And it's just so ironic that they, continue to have their articles about me and my work for patients and community, because that's what it's always about, instead of upholding these institutions that continue to abuse their institutional power rooted in anti-Palestinian racism. But, I think we have to continue to center the Palestinians in Gaza that are experiencing an ongoing genocide. These front lines that are happening in Canada and the United States on university campuses, at medical schools, this anti-Palestinian racism, it is so important to tackle as well. But it is very much a distraction, and a distraction from the atrocities of what's happening in Gaza, right? Where people want to center what's happening in Gaza, calling attention to it, wanting, universities, medical schools to take part in, BDS campaigns. And then people are getting this anti-Palestinian racism backlash that is completely racist and discriminatory in of itself. So I do see the tides turning, and very much like what I'm doing is just what feels right as the next step. Like I want to tell myself in the months and years to come, in the decades to come, if I live that long, that I did everything that I could in this moment, everything within my power to put an end to this ongoing genocide. And I think more and more doctors in Canada and other healthcare professionals are certainly getting more comfortable because there's power in numbers, and we protect each other. Like in the way that Dr. Ben Thompson reached out to me and protected me in many, many ways. I got suspended at 8 o'clock in the morning on a Sunday from a phone call by someone who didn't even make the decision. So they were just a messenger. And before noon, I had already had a 1-hour conversation with Ben Thompson, who I didn't know at that point, about strategy and next steps, and getting in touch with his legal team, who became my legal team as well. So there are certainly ways to push beyond anti-Palestinian racism, and also see it as an opportunity that we will not go down without a fight. If anything, we're going to take retaliatory actions, like Dr. Ben Thompson is suing the hospital now that suspended him out of racism.
Yeah. Thank you so much for all of your work, and for being, really an instructive mentor to other, young physicians who are watching what's happening, and watching how people are using their consciousness and their morals and ethics, really living up to the oath that physicians take to help people. And so your work is extraordinary. Thank you so much for being with us. We hope that you can come back on at some point soon. There's so much to talk about in terms of health care and the crushing of the health system in Gaza. So we'd love to have you back on.
For sure. Thank you so much for the conversation.
Thank you so much. Dr. Yipeng Ge, a physician based in Ottawa. How can people read your posts and follow you on Twitter? What's your handle?
I'm on Twitter and Instagram, and my Instagram handle is my first name, YIPNG _GE, and my Twitter account is also just my name.
Excellent. And your website we have down there on the bottom at the scroll, ipeng.ca. Thank you so much, Dr. Ge.
Thank you.
Thanks for watching this video. Please subscribe to our YouTube channel, hit like, leave a comment. These engagements help us with the YouTube algorithm, and it helps us to get around Silicon Valley censorship as much as possible. It does make a difference. You can also support our journalism by going to electronicintifada.net and clicking on Donate Now. Thank you.